Hello, we're going to be taking a look at the American Cancer Society sheet about skin cancer. This is the skin cancer fact sheet. That's what we're going to be talking about. So let's take a look at it. Skin cancer fact sheet this is for patients and caregivers. Now, skin cancer is the most common type of cancer in the United States. Basal and squamous cell cancers are the most common types of skin cancers. Melanoma is less common but causes almost all skin cancer deaths. Risk factors. These include exposure to ultraviolet rays. Sunlight is the main source of UV rays, and tanning beds are another source of UV rays. Now, having light-colored skin can contribute. Anyone can get skin cancer, but people with light-colored skin have a higher risk than people with naturally darker skin color. Age. The risk of skin cancer rises as people get older, but these cancers are becoming more common in younger people. Gender. Women are more likely than men to get skin cancer before the age of 50. Men are more likely than women to get skin cancer after the age of 50. Having a weakened immune system. People with weakened immunity have an increased risk of skin cancer. Moles. People with many moles and those with large or irregular moles have a higher risk for skin cancer. Personal history. People who have already had skin cancer and people who have other skin conditions such as a skin injury or inflammatory skin diseases, actinic keratosis, psoriasis, or xeroderma pigmentosum have a higher risk of some types of skin cancer. Family history. People whose parents, brothers, sisters, or children have had melanoma may be at a higher risk of melanoma. Radiation exposure. People who have had radiation therapy have a higher risk of developing skin cancer in the area that was treated. Exposure to certain chemicals. Being exposed to large amounts of arsenic increases the risk of developing skin cancer. So arsenic is a danger. Prevention. There is no sure way to prevent it. There's no sure way to prevent skin cancer, and some risk factors can't be changed, such as the age, skin color, and personal history of the disease. But there are things a person can do to help lower their risk, and these include limit exposure to ultraviolet UV rays. Seek shade whenever possible. Avoid the sun when UV rays are strongest, which is usually in the United States between 10 a.m. and 4 p.m. generally, depending on where you live. The further south, the longer the period will be to deal with that. Puerto Rico and Hawaii and parts of Alaska, of course, will have differing time schedules for you, so keep an eye on that. Use a broad spectrum sunscreen with sun protection, which is a sun protection factor SPF of at least 30. I like 90. I know they say it doesn't work, but I love it. I just put it on. It smells good. It's great stuff. Wear clothes to protect your skin, such as long sleeves and long pants when you're going outside. And I know you're outside. It's really hot. You don't want to wear a long sleeve shirt. Don't want long pants. Let's think back in the history of the United States where people were living back then. Loose fitting, cotton clothing, hemp clothing, loose fitting, right? You got the long sleeves going on there. They even wore gloves and stuff like that. Nice hat. You like my hat? There you go. That's a UV controlling hat. It's got some shade on it. So you can go outside with long sleeves and long pants and still feel cool. Believe me, I've done it plenty, even in temperatures of up to 100 degrees. Cover your head with a wide-brimmed hat that shades the face, neck, and ears. And I got to shade my ears. Wear large framed wraparound sunglasses that block UV rays from your eyes and the skin around them. I'm going for that next. I haven't done that yet, but I got to do that. These glasses are so big, but I'm going to get one. Look like a robot. Avoid sunbathing, tanning beds, and sun lamps. Just avoid them. Protect children even more, since they tend to spend more time outdoors, and they're not, they're dependent on you to cover them up and everything. Babies younger than 6 months should be kept out of direct sunlight and protected from the sun using hats and protective clothing. You remember all that happening when you were a kid, right? You saw them. You could look at paintings too. People delicately covering the little babies there. It's all sorts of cool stuff. Avoid exposure to harmful chemicals. Very important. Follow all chemical instructions. Learn all about the chemicals in your environment, even in your local environment. You may be surprised what you find there. Check your skin regularly to spot any new growths or changes and report them to a doctor right away. Let's go on to page 2. It's the second page. We're almost done. Early detection. Even though the American Cancer Society does not have guidelines for early detection of skin cancer, everyone should know their own skin. You should know your own skin. You're in your own skin. Check it out. You should learn the patterns of moles, blemishes, freckles, and other marks on your skin so you can notice any changes that occur. Many doctors recommend checking your skin, preferably once a month. Skin self-exams are best done in a well-lit room in front of a full-length mirror. Use a handheld mirror for areas that are hard to see. Any spots on your skin that are new or changing in size, shape, or color should be checked by a doctor right away. Signs and symptoms. Signs of skin cancer may include changes in the size, shape, or color of a mole or other skin lesion, or a new growth or spot on the skin. Let your doctor know about any spots that are new or are changing. Basal cell skin cancers may appear as flat, firm, pale, or yellow areas, raised reddish patches that might be itchy, small shiny bumps that are pink or red, pink growths with raised edges, or open sores that don't heal or that heal and then come back. Basal cell cancers might bleed after an injury. Squamous cell cancers may appear as rough or scaly red patches, raised growths or lumps, open sores that won't heal or that heal and then come back, or wart-like growths. Melanoma may appear as a new spot on the skin or a spot that is changing in size, shape, or color. Other signs of melanoma include a sore that doesn't heal, changes in the skin around a mole, itchiness, tenderness, or pain. Treatment. Treatment for skin cancer depends on different things. It depends on the type and stage of the cancer, as well as the person's age, other health problems, and personal choices. Also, special testing might be done on the cancer to figure out the best treatment. If you have skin cancer, talk to your doctor about the best treatment for you and keep up on it. Living with skin cancer. Having skin cancer affects a person's quality of life. Physical, social, mental health, spiritual, and money issues can come up at any time. Some types of skin cancer, especially melanoma, can be serious. Palliative care is focused on helping to improve the quality of life and dealing with issues that people living with a serious illness might have. People with melanoma may benefit from having palliative care at any time, so reach out, ask for it, get it, if you need it. Good communication between a person with cancer and the healthcare team is important. It involves asking and answering questions, working together to set care goals, making shared decisions, managing side effects and other issues, scheduling follow-up tests, and care. So here's a lot of information for you about skin cancer. I hope it's helpful. Please visit the American Cancer Society website at cancer.org/cancer/skin cancer, because they got a lot of information out there, the American Cancer Society. So, or call 1-800-227-2345. That's 1-800-227-2345, 1-800-227-2345, and online cancer.org/cancer/skin cancer. Thanks for listening today. Good health to you and yours.